All right, chapter 56, caring for mothers and babies. Do you think that you have, as an opportunity for a CNA, do you think that this is a huge area of CNA work?
No.
Not really. There's the potential maybe in the ER if you're working in there. There's also the potential if you were helping out at an OB clinic, maybe. But I will tell you that most postpartum floors are most delivery floors even. So where the mother goes to have the child in labor and delivery, they just have nurses and they don't really use CNAs. One of the positions on the floor though is a surgical tech, okay? Because they have to keep a surgical tech there at all times because there's always a chance of what needing to be done? A C-section, okay? And they need to use a surgical tech. So if you were like a crossover, which there are some people that do that, crossover as a surgical tech / CNA, then you could be working on the labor and delivery floor, okay? But the main thing would just be like ERs mainly, clinic possibly, and so forth, okay? I don't know why I always do that. Mothers and newborns usually have very short hospital stays. If it's a vaginal birth, it can actually be 24 hours in the patient and the mom and baby are going home. If it's a C-section, it's usually max of 3 days or so. Unless there's major complications, then of course it can be longer. Common reasons for home care after discharge. So when I was in nursing school, I actually got a great experience. The hospital that I followed on labor and delivery, they actually did a follow-up visit. Every single mother that delivered a baby at their facility, they got a follow-up visit 2 to 3 days after the mom and baby went home. This was really, really good because they weighed the baby. They helped mom with any feeding issues. They checked on postpartum depression that can start to set in around that time as well. They just really seen what kind of resources went into the home. So it was a nurse and a CNA could go along with there too, but this would be a home visit, okay? So common reasons for home care after birth is if there's complications before or after childbirth, if there's health problems, if they need help with other young children in the home, if they've had a multiple birth, or if they need help with meals and housekeeping as well. One thing to keep in mind is that babies cannot protect themselves, okay? So babies cry to communicate, so maybe they have a wet diaper. Maybe they're hungry, they're hot or cold, they're tired, they're uncomfortable, or they're in pain. To promote safety and security with an infant, they cannot protect themselves, okay? You should respond when they cry. You should feed them when they're hungry. You should change their diapers as needed. You should comfort them and talk to them, okay? Your nursery equipment should be safe and in good repair. It does not have to be new. It just needs to be not nails coming out of the side of it, okay? Babies, though, can become ill very quickly. Signs and symptoms with a baby becoming ill could be a new change in baby's behavior as well, and you should communicate that as quickly as possible to the nurse or physician when the symptom began. The pictures up here we're showing you a safety of a doorknob cover. Do you think this is essential when it's an infant? A doorknob cover? You know what that's for? That's to not let them in a room, basically, that may be unsafe or something like that. But when they're just infancy, not really needed. They can't walk, they can't open the door handle, and so forth. So you have a little time to get those going before toddler, before walking starts, that you really need those doorknob covers. Down here, she's showing you different hold techniques. So of course, the hold technique of holding upright. If the baby doesn't have head control, then you should watch the baby's neck so they don't fling back quickly and so forth. Also here is a hold position and then another one right here. One of the big safety things is car seat safety. So when I worked in the NICU, most of us had to become car seat certified. So we had to take a course to do this. For many years, it would be like a 2-day course. Very, very intense car seat safety course. Then they stopped having us do the car seat safety check for a while because of lawsuits and so forth, and then they gradually went back into it. So one of the big things is if you're unsure about a car seat before even having a child, is you can take it to local fire departments, and they are car seat trained to check your car seat and to make sure that it's installed correctly. Okay. One of the big things now, and this may be a little out to date here, honestly, is that we are now rear facing, honestly, a minimum until age 2. It used to be age 1 when my kids were born, but now it's a minimum of age 2, and they really want you to be rear facing as long as the child can tolerate it. Okay, can tolerate it. Then you move on to a forward facing in the same car seat. Then a booster seat, and then a seatbelt, of course, for the rest of the life. There's a lot of different things with car seat, but really, children 12 and under should always be kept in the back seat of the car. Helping mothers breastfeed. Breastfeeding is also called nursing. It is feeding baby milk from the mother's breast. The baby can be fed at the mother's breast, or the mom can pump milk from her breast and feed it to the infant. Breastfed babies are fed on demand, meaning that they're fed when they're hungry, okay, and immediately. Nurses help new mothers learn to breastfeed, and you should tell the nurse if the mother or baby is having problems feeding, because we need to go help. Formula with bottle feeding babies. Formula comes in 3 different forms. There's the ready to feed that you don't mix up anything, just shake it up and it's ready to go. There's also powdered, or there's liquid concentrate. The liquid concentrate, I think at like Walmart, is usually on like the top shelf. It's going to be the most expensive. With the powder, out of all 3 of them, it's going to be the most affordable formula to purchase. Okay. Problem with the powder is that we have some people. If you cannot read, then someone needs to teach you how to prepare the baby's bottle with the formula. Okay. So 1 scoop for however many ounces, and so forth. You need to be able to do that correctly, because sometimes people that maybe don't have money for formula, or maybe they just didn't know because they didn't read it correctly, if you don't make the formula correctly, the baby could become dehydrated, malnourished, and this happens, believe it or not, and that's when DFS unfortunately gets in contact and can potentially take children away from parents. Okay? Bottles need to be prepared one at a time or in batches for just a 24-hour period. Okay? You should follow the container directions carefully. You should check expiration dates, and then use any bottles stored in the refrigerator within 24 hours. Otherwise, they need to go in the trash. You should protect the baby from infection by washing, sterilizing the bottles, the caps, the nipples, and the other items. Keep them as clean as possible, and so forth. What she is pouring out of right here, this is actually that liquid concentrate down here, preparing the bottles. Feeding the baby, most bottle-fed babies are fed on demand as well. Most babies do not like cold formula out of the refrigerator, so you should please warm it. But there are a few rules with warming bottle. You should never, ever, ever in your life warm up breast milk or formula in a microwave. Does anyone know why? Well, it's actually not even that, okay? What the microwave does to formula or liquids is it actually makes hot spots within it. So you think you test milk by putting a little bit on the inside of your hand here and seeing if it's warm, okay, on the inside of your wrist. But if you tested it, it may come out that it's okay, like, you know what I'm saying, the temperature. But what the microwave does, how it radiates the food or cooks the food, it actually makes hot spots. So there could be like a few spots in the milk that are extremely hot and burn the infant. Does that make sense? So that's why you never, ever, ever want to heat a bottle of milk in the microwave. What you should do is it says warm it in a pan of water on the stove. Also, you could heat up water in the microwave and then put the bottle down in it. Of course, make sure that there no more water gets in it. So you're just putting it far enough to get that milk heated. You normally need to do that for 5 minutes, 5-10 minutes or so, okay? You can also just hold it underneath there, just making sure that it is warm and not cold, okay? This is showing you using a bottle brush. Also cleaning the nipple out is essential. And then this is showing you how to test the baby's temperature, or the bottle's temperature, right here on the inside of your wrist. So solid foods start to be given at 4 to 6 months of age. Usually we start with baby rice cereal and just kind of go from there. The cereal needs to be mixed with breast milk or formula to thin the consistency and never water. Never, ever, ever water. Burping the baby. Babies take in air during feedings, whether it's breast or bottle. Air in the stomach and intestines can cause cramping and discomfort, and that can lead to vomiting and very, very, very fussy babies. Okay? Burping helps get rid of that air. Most babies burp midway through a bottle and then after the feeding. You can pat or rub the baby's back with circular motions, and you should do this for at least 2 or 3 minutes. Okay? It does seem like breastfed babies that are actually feed on the breast don't burp as well. Okay, but they just don't have quite as many opportunities for air as a bottle-fed baby. Also, this picture is showing you to never prop the bottle. This bottle propping, using a pillow to prop the bottle up so that you don't have to sit there and feed the baby. This has been proven in a lot of dental studies that it causes cavities and so forth. Okay. You should, continuing on here with burping, you should position the baby for burping in one of the following ways. You can do over the shoulder, on your lap. If you do on your lap or on the baby's stomach, then you should make sure to support the baby's neck at all times. Okay. Over the shoulder, make sure you put a clean diaper or towel over your shoulder to protect yourself as well. On your lap, support them in the sitting position. Hold a towel or diaper in front of the baby. And to remember to support the infant's head or neck for the first 3 months after birth until they can hold it up on their own. Pretty much the same as the stomach method. Okay. Diapering a baby. Breastfed babies are going to have yellow and very seedy looking stools. They are pretty loose as well. They're soft or runny in a loose stool. The digestion process is just different from breast milk than formula. Bottle-fed babies have yellow to brown stools and their stools are firmer. Over time, the elimination pattern develops and you'll learn the infant or child's elimination patterns. Stools should be usually soft and unformed. Hard or formed stools may signal constipation, so little round balls and so forth are definitely going to warn you of constipation. If it's a watery stool, that means diarrhea, and that can become very serious in infants very quickly. You should tell the nurse immediately or at once if you suspect constipation or diarrhea. Diapers should be changed when they're wet or when bowel movements or stools are present. Have any of you guys ever seen cloth diapers? Okay. On TikTok. Yeah, so my mother used cloth diapers on us, and then she used them. I only realized that because my sister was born 7 years after me, and my mother used them on those as well. It was definitely a thing in the 80s, early 90s, but then it seems to be coming back and so forth. So you put, if there's a stool or whatever, you put that in the toilet, okay? And then you do not put cloth diapers with the normal laundry items. You just don't put it in with everything else. It needs to be a separate washing, usually like a pre-soak and so forth. But you need to care for cloth diapers. If they're wet, you need to grab a clean, dry one and so forth. Otherwise, disposable diapers are just fine. There's different kinds of them. Some babies break out to certain brands or another. So you just kind of have to figure that out, unfortunately, as you go.
I think I want to use both. You know, like
I think,
disposable for traveling or anything like that, but like cloth at home.
Yeah, I never did cloth diapers with my twins because it was twins, and I don't know. We just never got there. You know, had it been one, there was some consideration, but we never got there. With cloth diapering, you should of course wash them in the hottest water you have, in the sanitary water. You should use a baby laundry detergent. So for many years when I worked in the NICU, we were recommending Dreft because Dreft was the only baby laundry detergent. Okay, and it smells so good. But guess what? Its price is stupid. Okay, Dreft, Dreft. They still make it. It smells great. I'm gonna be really honest with you. But since then, they have came out with all of these laundry brands. So the same one that you currently use, whether it's Tide, Gain, All, I don't care what you use, okay? they have all came up with a brand that you can actually use with clothes and cloth diapers on infants. Any of those that say that they have no scent or none of that, the white, they're all white. Tides is white, Alls is white, Gaines is white. White container in the
We
store.
used it on my brother's clothes.
Yeah, and we have to use it too because we have too many allergies in our house. Okay, but it's not scent is the deal. Okay, so otherwise Dreft or anything unscented. Trust me, a baby rash. Everyone will have one. You never want to go through it, but everyone will have one at some time. Put them through the wash cycle a second time without detergent. This is still on the cloth diapers. Hang them outside to dry if possible. Otherwise, dry them in the dryer. Disposable diapers are going to be secured with the Velcro or the tape or the strips. Fold them together and discard the diaper in the trash container. Never flush a diaper down the toilet. That's asking for a $20,000 plumbing bill. Okay. Changing diapers often helps prevent diaper rash. So, when changing diapers, you should make sure the baby is clean and dry before applying a clean diaper. You don't just, when the baby pees, you still have to wipe the baby, okay? A lot of people don't do that for some reason. Even when they pee, urine is very acidic, okay? And it needs to be cleaned off every time. So if you as a CNA or anything are practicing and you're starting to see a diaper rash at all, you should tell the nurse at once. All right, so we're moving on here to kind of postpartum care and so forth. Post meaning after birth care and so forth. So care of the umbilical cord. There has been so many back and forths on this in my career as well. Like, oh, we let it dry out. Oh, we use alcohol to help dry it out. Oh, we don't do anything to it. Oh, we use this. Oh, we use that. So there's been so many changes with this throughout the years in science and blah, blah. But this is going to be how we need to recommend to do it. So the umbilical cord connects the mother and the fetus, okay? It carries the blood, the oxygen, the nutrients, everything to the fetus to keep it alive. Shortly after delivery, the doctor clamps and cuts the cord. A cord stump is then left on the baby, okay? The stump needs to dry off and fall off about 2 weeks after birth. Secret is you have to keep it dry. The one time you get it wet, that 2 weeks starts over, okay? So you will notice it gets dry before leaving the hospital. It's dry. It's getting dry. So that means that you cannot put a baby that the cord hasn't fallen off in a bathtub. Okay, you have to do like a sponge bath with washcloths and so forth. You cannot do a bathtub bath with a baby until their cord falls off. Okay, there should be a cord clamp on there and so forth. This cord could potentially provide a place for microbes to grow. You need to keep it clean and dry. You don't put anything on it now as the recommendation, not even alcohol to help dry it out or anything like that, just nothing at all. We talk about cord care is done at each diaper change if there's any blood or anything like that shortly after the baby's born. Then we clean the baby's skin and so forth and make sure that it's clamped. This talks more about it and so forth, and that we used to use these things. And this baby doesn't have much of a cord on there, but a little bit, which is nice. But mainly keep it clean and dry. Keep also the diaper. When the baby still has their cord, you have to roll the tops of the diapers down and then Velcro them on. Okay? Do not pull the cord off no matter what you do. You should report any swelling or pus or drainage from it, or if there's a fever as well. Circumcision. Circumcision is the surgical removal of the foreskin from the penis. This procedure allows for good hygiene. It is thought to prevent UTIs in infants and lower the risk of cancer of the penis. Also, it decreases the risk of STDs. But circumcision, is a religious ceremony with the Jewish faith. It should not interfere with voiding or peeing at all. But you should observe for signs of bleeding or infection. Normally they do circumcision before the infant leaves the hospital. They have to get parent consent to do this. And we are one of the only countries that does a lot of circumcision. I would say 95% of the patients in America are circumcised that are male. Okay? Now, if you have somebody from another country and so forth, then there is a chance that they do not believe in circumcision. Right? And that's a pretty normal practice as well. The circumcision should heal in 7 to 10 days. I really like to say much sooner than that. The circumcision care, so that you start to do this after the circumcision has been done. What they do with the initial, after it's been, the foreskin has been cut off, then they load up the diaper with Vaseline, okay? They load up, they put lots and lots of Vaseline all around the penis. We are making sure that the penis is not going to stick to the diaper, because scabs, when they form, it would stick to the diaper, and every time you take a scab off, what happens? It bleeds. So you want to stop the bleeding. So the first diaper after a circumcision is going to be bloody. I'm going to be real honest with you, and it should be. But you should also have enough Vaseline. So they typically want you to apply Vaseline. They'll give that to you. You can use mild and soap and water to clean and so forth, and use white still, but we're going to use that Vaseline for at least like 1 full day or so to make sure that circumcision does not stick to the diaper. Okay. Bathing an infant. A bath is going to be very important for hygiene and good skin care, comfort, and to relax the babies as well. It's a time to hold and touch and talk to the baby and provide stimulation as well. Stimulation is very important, that a baby get held and talked to and so forth, because being touched helps aid the babies learn safety and security and love and belonging that they need. Planning for the bath is going to be the most important thing that you can do. That means having everything set up before you're actually in there. Because can you leave a baby in the bathtub? No, you're actually going to be holding the baby actually in a way too during the bath. So you can never leave a baby. So the most important thing, especially if you're alone, is that you don't forget anything and that you plan for the bath. There are 2 different bath procedures for babies. There's sponge baths at the beginning before the cord falls off, and then a tub bath can be given after the cord site and circumcision heal. Nail care. The baby's fingernails and toenails need to be kept short, otherwise they cut themselves. Nails are best cut when the baby's sleeping. Hold the finger or toe with one hand, press the skin underneath the nail like this, okay? And for fingernails, clip following the natural shape of the nail. For toenails, clip straight across, as for an adult. And you should make sure and watch for any sharp edges, so you should smooth those out as well. Weighing infants. The infant's birth weight is the baseline for measuring growth. Actually, infants lose up to 10% of their body weight in the first week of life, okay? Because they lose that brown fat they have stored up. And then they'll start gaining after that. To measure the amount of breast milk taken during a feeding, you weigh the baby before the feeding and then after feeding. Otherwise, you don't know how much they're eating. Postpartum means after childbirth. The postpartum period starts with the birth of the baby and it ends around 6 weeks later. The mother's body returns to its normal state during this time, and the mother adjusts physically and emotionally to childbirth in this time period as well. A vaginal discharge is called lochia. There's all different types of lochia that we're going to talk about here that occurs after childbirth. Lochia is going to consist of blood and other matter left in the uterus from childbirth. Lochia rubia is going to be a dark or bright red discharge, and you're going to see that for the first 3 to 4 days. After that, it's going to change to lochia serosa, which is the pinkish brown discharge, and it lasts about 10 days after birth. For 2 to 6 weeks following after birth, it's going to be lochia albia, which is a whitish drainage. So in this scenario, 2 to 6 weeks after birth, this is not a sign of infection. This is just normal discharge that comes after birth. Okay. Normally, lochia smells like menstrual flow, but foul-smelling lochia would signal an infection. Good peri-care for care of the mother after birth is very, very important. Sanitary pads should be changed often. When wiping after elimination, the mother should always wipe from front to back. Sanitary napkins need to be applied or removed from front to back. Good hand washing is essential. And then standard precautions of bloodborne pathogen standards should be followed. Some mothers have episiotomies. An episiotomy is where the doctor performs this procedure during the vaginal birth. Most mothers don't even know it's happening when it's happening. And it is the doctor's call at the time. Some doctors, it's a belief now to not do it. Some believe it's better to do it, and so forth. What it is this is going to be where they increase the size of the vaginal opening for the baby. They use a scalpel. They cut the mother's vaginal area, or Some believe in letting you rip, and some believe in an episiotomy or cutting. And so complications can develop with these, but the biggest things for us to help with and afterwards, and the biggest comfort items, are something called a sitz bath. A sitz bath is basically like that boudet thing. So it's basically squeezing water, like kind of like a fountain. Okay, I'm really glorifying this a little bit here. And doing that multiple times a day actually helps with the healing process of an episiotomy or a tear. Okay? Tell the nurse if the mother is complaining of pain, discomfort, or discharge from the episiotomy. Some mothers deliver by cesarean section or C-section. If the baby was delivered through an incision in the abdominal wall, then it is called a cesarean section. You need to remember that mothers that have a C-section, they have underwent a huge abdominal surgery afterwards, okay? A huge abdominal surgery. Yes, they're doing these nice bikini cuts now, where they used to do like a full cut like this. Now they're doing nice bikini cuts. I mean, that's very nice, but it's still, when you cut through the abdominal wall, you're cutting through layers of muscle and tissue, and you need to have some empathy for the mother as well, okay? A C-section is not just automatically done. There has to be several things that the mother has to fit a criteria in order for this to be done. It needs to be done to save the baby or mother's life in an emergency situation. If the baby is too large, and that's been completely verified to pass through the birth canal. If the mother has a vaginal infection like CMV, HSV, that could be transmitted to the baby, then they will choose a cesarean section. Not they, the doctor will choose that for them. Also, if the normal vaginal delivery will be too difficult for the mother or baby. If the mother has been laboring for 24, 36 hours, and there's no signs of progress, then that would be another sign that they just need to go in and deliver the baby by cesarean. Do you know why some reasons might be that cesarean might not be as good for the baby? Cesarean C-section versus vaginal. Why might it not be as good for the baby? Because a lot of women just want a C-section. They don't want to deliver vaginally. But guess what? It's not necessarily a good option for babies. Does anyone know why? This has nothing to do with this lecture. It has all be. I'm going to tell you the real reason why. First of all, a baby was meant to be born vaginally. Okay? And so, when a baby is born vaginally, a baby is squeezed on, right? Okay? A baby is squeezed out. And so, guess what all gets squeezed? What's really, really helpful? When a baby comes out vaginally, their lungs are being squeezed out. Okay? So, a C-section baby, from a NICU nurse or a nurse's perspective, they have super wet lungs, meaning that they're more at risk for pneumonia. They don't ever get that opportunity to get that fluid squeezed out of their lungs. Okay? So, we watch them a little bit closer. They have more problems after delivery and so forth. So, mothers that there for a while, insurance companies were letting some mothers just choose a C-section and not hit that criteria. Then that quit after years of figuring out. It's like, oh, we're actually maybe potentially harming the baby. Now, we can do a lot of suction and maneuvers for the baby to help with those wet lungs and so forth, and treat a pneumonia in a baby too. But that's not what people usually want. Okay. So, if we need to do a C-section, it needs to be done to save the mother or the baby and so forth. But it doesn't just need to be an automatic elective C-section kind of thing. Like, oh, I have a C-section, I don't want that thing going through me, okay? Because it never gets the opportunity to squeeze those lungs out. The mother usually has emotional reactions after childbirth. This is from hormones, lifestyle changes, lack of sleep, frequent visits and telephone calls, advice and opinions about parenting, unwanted and wanted. The mother can help herself by resting when the baby sleeps and taking time for herself and her partner. Complications can happen during pregnancy, labor, and delivery, and in the postpartum period as well. So, a mother has a vaginal delivery yesterday. She just finished breastfeeding and stands to lay the baby down. As she stands, she said, I just felt a gush of blood. Is that normal? How will you respond? Describe an abnormal vaginal discharge after birth. Well, I'm just gonna tell you here. So it says that she delivered a vaginal delivery yesterday. She just finished breastfeeding, she stayed to lay the baby down, and she felt a gush of blood. It's honestly probably okay, alright? Because you're still in that lochia rubia stage where it's that bright red blood. It's probably okay. It's worth going to the bathroom and checking, okay? Because mothers can hemorrhage out after delivery. But there is quite a bit of blood in those first 2 days, okay? Following a delivery of a baby. All right, moving on here. Any questions about caring for a mother and baby? So this test will be over 55, 56, and 57. 57, we're moving on here from caring for mother and baby to assisted living. I'm still recording. Assisted living, some of us got to see. Ellsbury has an assisted living facility a real quick summary would be that is still housing for older patients or elderly patients or someone that just still needs minimal activities of daily living, but they still want to remain more independent and so forth. So this offers independence, companionship, and social involvement in all the activities. There's little or no medical care needs to be provided. They might be provided with their medicine, and that's really it. Okay? It's a home-like setting is provided, and if any of you guys got to go down to Ellsbury or Vandalia, they opened up the apartments, I guess, while you guys were there, but I didn't get a chance to go down there. I've been in there before, but I didn't get a chance to go down there and see how it's going now. But these patients, really, the only thing they're really getting from nursing-wise is going to be their medications. Okay? Otherwise, there's really no medical services provided. Some of these are part of retirement communities. There are some state laws and licensing requirements for these, and they really vary. And then the residents' rights are going to be part of those laws as well. Like Tri-County Care Center actually wasn't all that interested in having their assisted care open back up because there wasn't that many patients there, but they actually were mandated by law in the past 6 months to reopen it, or that they wouldn't keep the rest of the facility open. So even at Ellsbury, it's a brand new assisted care, but it's not full, and it costs a lot of money. This is a brand new, it looks like $1 million facility attached to the nursing home, long-term care center, but it's still not full, okay? But people kind of have to get back into that after COVID. There's several patients over there, but it's nice. The patients can bring their vehicle there. Most of them aren't driving anymore, but they can kind of come and go a little bit with certain restrictions and rules and so forth. So there's still somebody over there, generally just like one person. It could be a CNA, just one, just to kind of help with the activities and the food and so forth. But there's really typically just like one person over there. The purpose of assisted living is that a person, they don't want to live alone or without family. So this is because people are living much longer. If they lose a life partner or spouse through death or divorce, never married or having small families, they don't have anybody that can help them or come check on them, then they might need to go to assisted care. Children growing up and moving away from their families might be a reason as well. These residents usually just need help with like one or more activity of daily living, like personal care or meals or taking medicines, housekeeping or personal safety or transportation as well. They do not need 24-hour nursing care at all. They are not bedridden. They don't typically have chronic illnesses or cognitively impaired with those mental status changes and so forth. And they typically don't have complex medical problems. They should have good mobility and be very stable in their health concerns. Should be just kind of normal health and aging process. These residents have the rights and liberties, though, as a U.S. citizen. They should still be able to vote. And they also gain some of the special rights, though, when the rules under state laws and rules of like nursing home patients as well. If they are unable to exercise their rights, they can, there needs to be another person that can act on their behalf, like a family member, a legal representative, or an ombudsman. Staff requirements vary among states on what they require in those assisted care facilities. But for sure, criminal background and fingerprint check are very, very common for this. Some states require training in this area, so the needs and goals of these residents, promoting dignity, independence and residents' rights, using service plans, ethics and privacy, hygiene and infection control, nutrition and menu planning, food prep, service, and storage as well. Other things might include like housekeeping, sanitation, assisting with medications, fire and emergency, disaster plans, communication skills, safety measures. So a lot of the same things that you would normally have to go through as well. These patients should receive a service plan of what they're going, the services that are needed, how much help is needed, who provides those. So kind of like a care plan for the patient, but this is communication, and it's really, really helpful. The plan should be reviewed when the person's condition changes, if the person's want or needs change as well. Meals, they should still be provided with 3 meals a day and snacks. Special dietary needs should be met. Menus should be posted for the residents to see. Residents here are going to for sure eat in the dining room with others, or they could eat in their rooms, but they're going to prefer that they eat in the dining rooms with others. Assistive devices could be provided, and so forth. Housekeeping measures, usually just to keep infection and keep living units neat and clean, are in place as well. Food safety, there's certain measures that are needed to handle and prepare and store food, just like any location. Laundry, clean linens are provided. The residents can use the washer and dryer and ironing board though. There's very limited nursing services with these patients, but the nurse may need to assess or monitor their health if they're having any problems, supervise tasks delegated to others, give medications as well. With medications assistance, the medications should be taken as prescribed. The 6 rights of drug administration, these are very valid for everything here. We should verify that it's the right medication or the right drug, the right dose, the right route. So is it going in by injection, by mouth, applied to the skin like a lotion? Is it the right time? Is it the right patient? And are we doing the right documentation? So these are the 6 rights of drug administration. Those are going to be pretty important for you to remember. Your role in assisting with drugs or medication depends on your state laws, your training and education. You could be a certified med tech very easily after you have your CNA. Okay. Remember though, as a CNA, you do not give drugs. The person also has the right to refuse any prescribed medications. Residents in assisted living may manage and take their own drugs if they're able, but pill organizers are often going to be used. And we need to make sure that their pill organizers are done correctly, though. Medication reminder means reminding the patient to take the medications, observing them, taking them, and charting that they were taken. A medication record is kept or a MAR, and you should report any drug error to the nurse immediately. A drug error means that one or more of the following has taken another person's medications, taking the wrong drug, the wrong dose, at the wrong time, or the wrong route, not taking it, and then not reporting the drug was taken either. Storing medications, they should all be kept in a safe place behind locked doors typically. Patients really shouldn't store their own medications unless that's in their care plan, honestly. They must have the original pharmacy label, and then we should always be checking expiration dates and so forth on them as well. With activities and recreation for these patients in assisted care, these residents are urged to take part in activity and recreation programs. They may have some special services as well in case of an emergency and so forth. With transferring and discharging and evicting, so if we have to kick a patient out, all 3 of these can happen. And then the state requires that you document that and kind of communicate what happened. Maybe that the assisted care facility can't meet the patient's needs anymore. If the patient fails to pay for the services agreed on, or if they're just breaking their rules and policies. If the patient wants to transfer, or if the assisted care facility closes, then that could be a reason for any of these things. Alright, so this was assisted care and mother-baby care Any questions on these two chapters? This was 56 and 57. Last week I lectured on 55 accidentally about sexuality. Okay? I'm going to prefer you take this test on Wednesday, Thursday being the latest. I will review it with you tomorrow. Understood? I think it's easy.